Hi all, thank you so much for joining us today. We're going to walk through a little bit about what we're doing in VA as it relates to immersive technology and how we're leveraging immersive technology to define a new reality in healthcare delivery and experience. First, I would like to begin by introducing you to our team, the VA Immersive team. I'm Ann Lord Bailey. I'm a pharmacy practitioner by training, currently the Director for Clinical Tech Innovation and Immersive Technology Lead. And then we have a team of other clinicians and as well as innovation specialist, Caitlin Rollins, Deputy Director, Evan Davis is Immersive Technology Project Manager for us, alongside Kim Balicki, who is also an Immersive Technology Project Manager. We're excited to be here with you today. We always like to lead with disclaimers so that we can speak freely. One, we do not at VA endorse a particular product or company, but you will see brand names and hear stories, and we're happy to share those. But just to be clear that we do not provide any particular endorsement. As the Director for Clinical Tech Innovation and Immersive Technology Lead, I work in the Office of Healthcare Innovation and Learning. We sit beside the Office of Research and Development within VA, as well as academic affiliations. Importantly, though, our focus is intentionally innovation. And within our office, we have 4 main programs. And our program, VA Immersive, spans across and leverages the capabilities and capacities of each of those programs. Within SimLearn, there's a focus on simulation training and education. Within the VHA innovation ecosystem, the focus is building that innovation muscle of our frontline staff, leveraging human-centered design to then implement and scale innovation. In our Center for Care and Payment Innovation, the focus is transformational business and care models. And then our newest program, Office of Advanced Manufacturing, where they focus on making what we cannot buy. And as you can imagine, there are opportunities for immersive technology in each of these programs. Now a little bit more about VA Immersive and how we've grown from where we began in 2017 to where we are now. More specifically, last year, just to give you a side-by-side comparison, last year we had about 750 frontline staff engaged with using immersive technology in healthcare across 130 unique sites. So if you're not familiar with VA, we are the healthcare portion of VA, the VHA. There's 171 healthcare systems and over 1,200 sites of care. Across those, 130 are engaged with use of immersive technology. A year ago, we had 3 active collaborations working together with industry and academia to co-design, co-develop, and then to pilot immersive technology. We were receiving donations from different organizations related to in this case, imaginal prolonged exposure and then physical therapy were the 2 separate ones at 15 sites and then 18 sites. We had 1 national pilot that was funded related to creative arts therapy. We were hosting 1 community of practice, helping to equip the field in what we were doing with immersive technology and help to share knowledge, information, and really build that coalition of effort. And then we created an introductory guide that was served as a sort of a digital version of a 101 course. And now a year later, we have over 1,900 frontline staff engaged across over 160 different sites. We have 8 active collaborations, our 2 donation efforts. 1 is ongoing and now up to 29 sites. We are overseeing 10 national pilots and we host 4 communities of practice. We still have our general community of practice, but our frontline staff asked for some that had more focus. And so we now offer a community of practice focused on pain management in virtual reality. We have 1 focused on mental health and 1 focused on employee well-being. In addition to our intro guide that again provides definitions and context and sort of what is immersive technology and how is it being used across VA, to our playbook that is, okay, now we know what it is, how do we implement it? We make those readily available to our frontline staff. I'll talk a little bit more about that. But our story began in 2017, where we had about 5 different VA medical centers that were leveraging virtual reality specifically for imaginal prolonged exposure. Those sites didn't necessarily work together. They were working and functioning very independently. And then Caitlin Rollins, that you saw as a member of our team, was a bedside nurse at the time and saw an opportunity to leverage virtual reality for post-operative pain and anxiety. and then began to see some of the challenges of implementation. So how do we make this scale across an organization? Because we want to know and see how helpful and beneficial it is to our patients. These are some of the things that we began to see. Caitlin has tracked some of these voices of the veterans. So what do the patients say and what's their perception? How do they experience virtual reality, and what's the impact on their pain and anxiety, specifically in this case? So some of these things you see are actual quotes from our patients. It took my mind off of pain and relaxed me. It took away my stress and took me somewhere else. I loved it. I want one at home. My breathing felt better while I was using that. And some of the things are really important, because one of the things we know about immersive technology that's a unique feature is the engagement piece, and the fact that patients will pick these devices up and put them on their heads, which is important because if it works and they'll use it, now we've found a really important intersection. Caitlin actually published her data, and one of the themes that was found throughout the qualitative evaluation was that VR awakened veterans to the possibility of expanding their use of non-pharmacological therapies. Really important in a time where we're trying to think about appropriate medication use and effective medication use. And so now we know that this is an opportunity to leverage this technology as a non-pharmacological approach. So what we saw with this early 3 different clinical uses across 6 different sites in 2017 now has expanded to more than 30 different clinical indications at VAs in all 50 states and in Puerto Rico. And so we've seen massive, expansive growth because of some of the engagement and the outcomes that we're seeing from patients. And earlier this year, we had the opportunity to talk to the Wall Street Journal about how we're seeing immersive technology impact our veterans. And this is an important thing to think about, is it's a lot easier to multiply headsets than providers. And so one of the things that we know is we will never have enough healthcare providers. But if we can leverage a technology that is effective and that will be used to help augment our providers, that expands the footprint of the healthcare system and helps us think about how we deliver care and how our patients experience care. We also know that we have this broad sampling of active use cases across VA. This is grown from 30, maybe even now 40 different clinical uses that we see. And the exciting piece of the puzzle also is that we don't see immersive technology silo the impact the way that we see other things. As a pharmacist, we prescribe medications to patients in VA based on specific indications. If we know they have hypertension or high blood pressure, then we give them a blood pressure medication. If we know they have diabetes, a diabetes medication. If we know they have depression, a medication that impacts depression. One of the benefits we see of immersive technology is we can take one approach, we can give them one experience in virtual reality, and it can impact multiple indications at one time. And this is a really unique and important feature. But also we see there's a wide range of indications that we also see impact in. These are some of the other national efforts that we have. Last year, there was one, and that one was the creative arts therapy. It was at 56 sites a year ago. Now it's 73 sites. But we've also added these others. I mentioned imaginal prolonged exposure that we had at 15 sites originally, now up to 29 sites. And then we've added some. So imaginal prolonged exposure, for those of you who aren't familiar, puts the patient back, the veteran back into a combat zone, which can be important to help impact PTSD, particularly if PTSD that has not been helped by other more traditional therapies. But what we also know is there are some day-to-day experiences that can trigger PTSD. And if we can help people in a safe environment where mistakes are free and we can experiences on demand, right? Those are some of the things we say about virtual reality and immersive technology. We know that we can put them through some in vivo experiences day to day. Can we address phobias related to loud noises or crowded spaces or dark spaces? Things that maybe if we haven't experienced combat or things that might be triggering related to PTSD, we can help them experience those day to day. We also know that we can develop content related to chronic pain and suicide prevention. We're working with Penumbra now to do that. We're leveraging 3 of our subject matter experts in psychology and psychiatry to help work with academic leaders and industry to come together to develop the right content. We're working with Applied VR on their reliever device to help think about, great, this device has been authorized by FDA and now has some reimbursement codes related to CMS. But what does that look like to actually implement that in real world settings? And we're testing that right now across 16 different sites. I mentioned our creative arts therapy program with Wyo Health. What's exciting about that is that has 10 experiences and a multi-user approach. So veterans within the same geographical setting or across VAs at different geographical settings can do creative arts therapy together, which brings together the community. Our community living centers are much like short-term rehab, long-term rehab, hospice care, but often the veterans, this is their residence and this is their home. So how do we offer them with, in this case, 9 sites across an East Coast in what we call VISN or Region 4 on the East Coast. We're testing 9 sites where we're leveraging virtual reality to help improve quality of life, decrease boredom and anxiety and things like that. Then we know that physical therapy is an incredible opportunity to leverage immersive technology to expand access and decrease costs and those types of things. Others that are actively designed or in active design are related to radiology and phobias. We are also developing content. There are some unique opportunities to do that across VA. We know that sexual harassment can be a barrier to veterans coming to the VA or to staff feeling comfortable and confident in their workspace. And so how can we leverage immersive technology to help people put other people's skin on and experience different things so that they can learn in a really meaningful way? One of the ways we're doing that is evaluating use of virtual reality for prevention of sexual harassment training. We also know that that inpatient discharge experience, so from the time it's about time to go home to the time you actually leave the hospital, is a really challenging time for the experience, whether it be related to education or expectations. So we know that we can use content in virtual reality to help people experience that and then build empathy in those experiences. And I have a little bit of data to share with you about how we've done that. Then we know that firearm safety training is really important. When it comes to suicide prevention, lethal means safety is one of the top opportunities to help prevent suicide. But we also know that people, for a host of reasons, aren't comfortable handling weapons. And so sometimes they don't understand the terminology or how to safely lock or disarm weapons. And so without expecting people to actually interact with these firearms, we're able to put them in a virtual experience, teach them some of the firearm safety to help address and support our veterans or others in moments of crisis to help prevent suicide, which is really important. For in moments that matter, that's our inpatient discharge experience. One of our early pilots, we had 18 champions across 10 different sites. And over a course of about 6 weeks, we had 380 participants go through over 145 sessions. Importantly, they experienced empathy for the veteran, for our patients. This positively impacted now how they will interact with our veterans, and they would recommend it to the other staff and colleagues to help impact how we all think about how we deliver care. Another thing we heard, we offered the VA Immersive Summit last year for the first time in June of last year to bring our executive leaders down to put their heads in headsets so that they could experience what our staff and veterans are experiencing. Because I could talk about this all day long, but until you experience it and appreciate the impact, it's just words, right? And so we offered this opportunity to our executive leadership. And one of the real assets of this event was our veterans and staff that came and presented. And one of our veterans said, it's wonderful that you're offering this to executive leadership, but are you offering it to other veterans? And at the time we weren't. But out of that comment, we created this event, which we call the Veteran Experience, or VXR, with a tagline of heads and headsets. Our first event was December 2022 in Orlando, Florida. We opened the door of a simulation center across the street from a medical center and invited any veterans and local veteran service organizations to come and just try the headsets on and see what they thought and give us feedback. Of the 44 veterans that showed up that day, 56% had never experienced VR before, but importantly, 98% said it was easy to use or very easy to use, which helps debunk some of the assumptions around emerging technology and immersive technology and how easy it is to use for our patients and our staff. They gave it a rating, virtual reality in general, a rating of 8.3, with 1 being terrible and 10 being life-changing. The average rating was 8.3, which is pretty impressive. And then we asked, would you like to see more virtual reality used in the hospital or clinic? 95% said yes. And then would you like to have it incorporated into your care at home? And 95% said yes. We are repeating this event around the country because we want to hear more of this feedback to know, one, how can we do it better? And two, is this even impacting your healthcare and your perception of healthcare and your engagement of healthcare? And the early events are saying yes. We're still gathering data. We actually did this event again in June of this year, and are still gathering data on that, but also have more planned in Biloxi, in San Francisco, in Los Angeles, in Atlanta, and other places, Salt Lake City. So we're looking forward to those opportunities. One of the things we know is really important is to lower the barriers to adoption. How can we do that? Create resources. And so I mentioned earlier our intro guide, we have that available to the public. So if you're interested, you can reach out to us at vaimmersive@va.gov. So vaimmersive@va.gov, and we can share that resource with you. We also have our implementation guide, our extended reality playbook. So how did we do it? This is where we share that information with the team. We also have available the innovation.va.gov website. So you can learn more about our office and the programs across our office that I mentioned earlier, but we do have our own specific page for VA Immersive, so you can learn more about our pilots, our approach. You can download that version of the playbook there as well. And there's more information about some of our pilots and efforts. If you have any questions about what we're doing, about how we do it, about what we're doing next, please don't hesitate to reach out VA Immersive at va.gov. We would love to engage with you, and again, appreciate this opportunity to share what VA is doing. So thank you for having us.